Hello, welcome to Dr. RS channel. I am Dr. Rifat Siddiq, and today I'm going to talk about anxiety. I have seen these days so many people are suffering from this disease, I would say, but it's actually it's not a disease. It's actually you can say people do not have a control on their life, and they feel overwhelmed and they get scared, they get afraid, and that's this anxiety is fight and fright. So actually I had a patient and I asked that patient, I said, what actually is bothering you? What is the things which is making you nervous? He said, I actually asked this patient some leading questions. I said, is it work? Is it studies? Is it family life? So I found out it was all three of them. So it's natural that a person who have a difficult family life, and then the person is working full time, and then also a student full time, so it's obviously it is overwhelming to begin with. So it's normal to get nervous, it's normal to get anxious, but we need to, before we label a big diagnosis, we need to maybe sort out some life things. Maybe we need to sort out which thing we can actually avoid. Maybe we can have some family life which maybe we can sort out if we can do anything better, or maybe study wise we can maybe take a break, or work. So we need to learn how to balance. That's extremely important before we label people, before we put them on multiple medications. But in the beginning, when they are really nervous and they are because they cannot actually they have a lot of symptoms. So what happens, how people find out or what their symptoms are? Sometimes they will tell me that their heart was racing so fast they couldn't do anything. It was like they could hear their heart in their ears. That's what sometimes people say. So and also their blood pressure goes up. They will have a sweaty, shaky, and then they will have poor sleep, poor concentration, poor memory in the long run. So there are lots of side effects. Sometimes I had a patient who would have a chest pain. Literally, I saw her in the emergency room almost every week. She will come with chest pain and it will look like she's having heart attack, but that was just an episode of anxiety. So then when we found out what was the reason, we need to find out the reason. What is happening? Her son died, and she would imagine that her son, he was the only son and he was young, 20 years old, so he passed away, he had a car accident, so there was a reason. So we have to get to the reasons, and then we have to find out how we can at least pacify the situation. When we are anxious and when we are afraid and when we are actually literally we're afraid, our cortisol level goes up, our adrenal level goes up. That's how this racing of heart, the blood pressure is high, you're sweating, poor sleep, all these things are happening. So we need to maybe first, before we give them lots of medicines, we need to maybe sit down with them. Maybe we can see how we can alleviate or maybe decrease their overwhelmness of that person. That is where counseling does help a lot. The counselor can sit down with them before we give them medications, and also we can talk about diet. A lot of time, if we modify diet a little bit, you will see that that might helpful. Some of the diet which can helpful is the vitamin B1. Vitamin B1 is extremely important. It actually helps in making the your amino acid, and amino acid can then make the melatonin and dopamine and serotonin. All these things are very well needed in our body if we want to stay calm. So that is what is probiotic also helps in making all these things. So how we can get vitamin B1 is from the fermented yeast. We call it nutritional yeast. The whole B complex is important. So at the end we want the dopamine, we want serotonin, we want melatonin. So that's very important. We should avoid foods which have GMO. We should also avoid artificial sweetener. That's really some of the things which we can do, simple steps to make things better for you. And eat healthy, lot of salad, lot of fruit. That's going to help you. Magnesium, zinc, copper are very important. You need to take those. Ginseng, ashwagandha, that's, I think a lot of people are using this, and it's really helpful. Avoid TV where you are hearing the negative programs, negative news, or don't be around people who are negative, because that negativity is going to really harm you, and that is going to bring all this nervousness. So don't get closer to those people who are doing negative, that's negative talk or negative or putting you down. So avoid those companies. Exercise is very important. Walking is very important. Just like these are going to again bring all these good stuff in your system. So when you have having any kind of symptom, maybe you need to sit down and evaluate your diet, evaluate your situation, put it on the paper, what things are bothering you, and when you see the doctor, then you take those notes with you. These are the overwhelming things, how we can make things better. Sometime when you speak up, you will also find the solution within your own conversation, within your own, own head. So it's good sometime to write down, sometime to talk. It's good to talk to people who are sincere to you, and that will also be helpful. I hope that this video was helpful to you. Thanks for watching.